Millions of Americans use home care. How many? Sometimes the data is not as clear as we'd like it to be. Sometimes we hear 15, 20 million people are using in-home care. Other times, is it 40 where we're not addressing the unpaid caregivers? What can we do? What solutions are available to shift the current mindset around home care? Well, we have two incredible gentlemen with an amazing company on talking about care on demand. What is it? Stick with us and you're going to hear it. But first, a message from our sponsor.
This incredible show made possible by our wonderful sponsors, Assured Senior Living, Love, It's What We Do, and Serenity Engage, where care connects. Now, a brief message from Serenity Engage. Serenity connects aging service providers, older adults, and their loved ones in a single network. Our web, mobile, and smart assistance products power the network that enables real-time, HIPAA-compliant communication, collaboration, and education. When we care together, providers increase revenue and lower expenses, older adults receive better care, and family has greater peace of mind.
All right, welcome back. And I have two incredible, amazing gentlemen. We have Mr. Stephen East, the founder and CEO of Caring on Demand, and Mr. Bryan Flynn, the Chief Operating Officer of Caring on Demand. Gentlemen, welcome to the show, and thank you for taking some time on your Friday.
Yeah, thanks, Francis. Glad to be here.
Yeah, thanks, Francis.
So Caring on Demand, what is it? Where did it come from? And kind of what's the drive behind it?
So I guess when we discuss where it came from, it's important to kind of understand our backgrounds. I founded a custodial private home care company about 25 years ago. So I've been living and breathing the aging industry now my entire professional career. Through the evolution of that business, you start to see certain themes emerging. Labor shortages, a secondary focus on customer service. Almost, it became not a very consumer-centric business. You start to see a lot of logistical challenges that were being solved by, let's say, back of the envelope computations, and not very data intense or not leveraging data. You really saw an industry that wasn't evolving with the times. And so through all those experiences and through conversations with my clients who would say to me, hey, Steve, it's great that Mary's here today for 8 hours, but I really only needed her today for like 25 minutes. So why do I have someone here for that extra 7.5 hours?
Right.
And I saw costs escalating, which was directly related to the fact that labor costs were escalating as well. And so you wondered, where was the elasticity going to kind of just break? And then what were the solutions that we could kind of think about in terms of addressing that? And that's when sort of the seed was planted, so to speak, for Caring on Demand, the idea of creating a really consumer-centric platform that would allow us to really optimize and leverage caregivers across a broader base, and we can talk about that, a broader base, to really enable us to provide the care that the customers wanted, not the care that we wanted to give them.
So that brings up a good point. I mean, you kind of talk about how, you're running into staffing, labor shortages, things like that. And I heard this recurring theme I think we talked about before we got on. Kind of give an idea of what is the current minimums? How does it look like in maybe the traditional sector that we're like, oh, well, why does someone need to have a caregiver there for 4 or 5 hours? Is that industry standard or is there more to it?
Well, first of all, there is no standard. And that's the best part about the industry, right? The standard is really being driven based upon the logistics of the provider. And when I say logistics, it makes sense. I have to get someone from point A to point B every day. Right. And it has to be financially worthwhile for me to do it. And it has to be financially worthwhile for that caregiver to go. So the logistics, constraints are a legitimate thing to consider. But if you think about it as a consumer-centric business, meaning the customers are paying out of pocket for these services, I'm dictating to them what they're getting. They don't say to me, hey, Steve, I'd like someone for 25 minutes or 35 minutes. I say, oh, that's great, Francis. I can get you someone for 8 hours because that's the only person I have available right now. So right? Like it's a customer service business. So the labor shortages is real. it's probably more so because of the demand. And also you do see a lot of individuals who are in the industry either aging out, because I remember a lot of caregivers I worked with in my past, they were sort of older. And the younger generation are not gravitating toward this field, and for a bunch of different reasons. And also, I think we just don't have the number of bodies you need for the demand. You know, depending on which data set you want to look at, depending on which one you can trust, there's anywhere from 1.5 to 8 million vacancies for paid caregivers in this country, and that's what we keep getting.
And I want to highlight that. I mean, that is such a wide gap. And we've talked about it before the show, 1.5 to 8 million, that's openings, that's vacancies. That's not accounting for the family members that are currently filling some of those voids, right? Because that's a whole nother demographic, the unpaid caregiver.
In that number, I think they say is around 39 million, 40 million of unpaid family caregivers in the United States, right? So you talk about a caregiver shortage, you know, it's bigger than anybody thinks.
And kind of with that, what do you guys think the economic impact on that? What happens to those 40 people that are unpaid caregivers? Think about the economic impact that they have on their own job,
I'll
right?
tell you, Francis, what AARP says it is. And it's $600 billion annually.
600 billion?
Yes. And there's a whole study in a calculation that supports that number. But that's triple the amount of paid long-term services. It's crazy.
Jeez, that is just a large number, and almost kind of this dichotomy that we're in is that we need more professional or paid caregivers, because obviously those family members, I'm sure, want to do it, but there becomes economic burden, like you alluded to. There's these minimums that make no sense, that are not driving the consumer-centric. Stephen, I love how you said it. We're a consumer business, and we're not listening to the consumer. So with kind of that, what have you done here? I'm going to pull what is your methodology here of how you're listening better to the consumer? What can someone do on your platform? Can I really get someone there for 30 minutes or an hour?
So let's also take a step back. So there's over 400,000 provider agencies in this country. And the provider agencies are truly the delivery service for the caregivers and the care to the clients at home, or what we call the recipients of care.
Okay.
So they're the employers. They meet all state regulatory requirements. If it's a Department of Health regulated state or some other governing body, these provider agencies have to meet those standards. They also have to meet all wage and hourly compliance standards. Okay. So our mission is to aggregate the provider agencies into a single uniform delivery network. Wow. And that's what the Caring on Demand platform does. At the same time, we also want people to start thinking about care, from a consumer perspective. What is it that they want? And also start thinking about care as not so much as, let me bill you for X number of hours and pay for X number of hours. Let me give you the care you need to accomplish certain tasks. I want to get up in the morning. That means I need a bath. I need help out of my bed. I need to get dressed. Task-oriented care that can be calculated at a different sort of per unit cost than per hour. And so we're trying to break it down into small digestible pieces and bring it all together within our platform. And our theory is, and I know this sounds like a leap, but we've seen it work, that if we break it down into tasks, and if we leverage the licensed agencies who do have capacity, just they're maybe underutilized, you can start meeting this increasing demand.
Interesting. So do you get, my initial thought is, do you get pushback from people that don't want to go do a 45-minute shift or a 30-minute shift? Or how is that kind of reception been from the care providers?
Yes, they hated it in the beginning. Okay. Then as we started, like everything else, right? The dispatch companies who didn't want to work with Uber, look where they're sitting right now. So
true.
The same conversation that we have, and it's like we need providers, we need agencies, we need people to provide the oversight, we need employers to kind of assume that responsibility. We don't want to be a gig solution, because I don't believe that works in healthcare. So in order to do that, but you do have to change the thought process, and that's a lot of our conversation and talking points. Is think about it differently. Your caregivers could earn more money when they do it on a task basis. You can earn more money because the billing model changes completely.
Correct.
And the other interesting thing is 70% of all caregivers want to pick and choose their own schedules. They don't want to be told where to go and when to go. So we empower them to say, here's my opportunities. Let me make my schedule. Let me build out my schedule for my day or even for my week. And then they go ahead and they fulfill those requests.
Yeah,
that's awesome.
You have individuals in the system, caregivers that are working 6-7 hour shifts. that are visiting the same person 3 or 4 times over the course of that 7 hours, right? So
Interesting. Okay.
the consumer is able to get maybe 3 to 5 touch points a day, make sure I'm up, make sure I took my med reminder, and going throughout. So you're able to get that more touch points, I think, with individuals, and you're stacking those times. So, the person is the caregiver themselves is working that 6, 7 hours. However, they're doing short stints, short tasks with each individual.
Well, I got to imagine too, as a client, you must feel super empowered though. I mean, you're not paying for things you're not using. I mean, that's got to be, your client retention just must be, incredible with this model, because they're not, calling in, why do I have to pay for 5 hours when I need 1? Or like you said, Stephen, the 30 minutes when you're paying for 7 or whatever it may be. The client feedback has to be super positive.
It's been awesome. And you have to remember that we have 2 clients that we're servicing. It's the recipients of care and their family members. The family members also are empowered with one of our apps to be able to create schedules for their parent.
So kind of walk me through that a little bit here. You have this, I'm pulled up here. You have the family app, but what is, if I'm a family member, what really power do I have? How can I really work through this to make sure my mom, dad, loved ones getting what they need?
You're the co-pilot or pilot, depending on how involved you are in the care delivery. You could go ahead and pick the schedule. You could go ahead and kind of, take care of anything that you possibly would want to. You can send messages to the caregivers for when they get there to see, hey, maybe today is Susan's birthday. We want to kind of mention that to her. You can do that with technology.
And I would say, just to add to that, you're getting that post-visit feedback, right? So, mom's visit happens, dad visits happens. Caregiver writes in, there was a fall, there was something, some other change of condition that happened. That information is all coming back to you at the end. So, hey, somebody came in, maybe I need to follow up with, with the caregiver, or follow up with my mom or dad to make sure everything's okay.
Right. Or primary care provider, whoever else you might need to have in your care circle to kind of make sure they're getting what they need. Correct. That's the on-demand information has to be, a big piece of mind. I'm assuming family members have, good feedback, great feedback on peace of mind component of having this there, or what's that?
It's funny. All of a sudden, when they finally were armed with the technology, they said, I didn't know mom was getting this many visits.
Oh, interesting. Okay.
And it somehow triggers, maybe I need to take mom to the doctor, or maybe this is great because I'm glad someone is going this often to see mom.
Right.
So, very positive. I think sometimes there's some information overload, just because you're going from a black hole void of any information into now having real-time information coming at you based upon the frequency. But other than that, I think they feel like they're really part of the care delivery experience.
So kind of walk me through how would it work? And, if I'm a home care provider, do I reach out to you, or do I need my caregivers to? Like, how, if I'm, currently licensed in Colorado to provide what we call custodial, non-medical, home care, what do I do? How can I get involved in this? Because I'm like, man, I could see this being a great revenue stream for me.
Yeah. Bryan, you want to lead off with that?
Yeah, no, that's exactly it. They can reach out to us, and then we help kind of bring them into the program. You kind of said it, Francis. It's a lead generation for them. Right?
Okay.
We're bringing clients are downloading our app, they're requesting service and requesting care, and we're bringing those into the providers that are in the network. So provider onboarding process is fairly simple. You kind of call us up and we put you in the network, and then we bring in caregivers that are underneath your your employees, and the caregivers then can utilize the platform and request, accept shifts and go from there.
Wow. So it's that simple. So if I'm a home care company that might have, that wants to, branch out and look at this model a little differently, is the simplest way to go to your website just to kind of join? Because I know you guys have to join the movement. Is that the simplest way to kind of get started on their process here to kind of move it forward and get things in their realm?
Yeah. If you fill out the form on Join the Movement, that just comes to us, and we'll reach out, right after that.
That's awesome. And are you, kind of, where are you currently? Do you have clients in home care companies in many states, or are you guys kind of focusing on one, state versus the other, or are you open nationally that this can become a national platform?
We're kind of being strategic about that. So we tend to kind of spin up providers and markets where we already see some demand, and we're targeting demand right now into a lot of the national senior living communities. They're the ones who came to us initially. Ultimately, we envision having payers involved in healthcare systems, and we definitely see this as an opportunity, a much broader opportunity. So once we know that there's a demand center, then we start to put together the providers and network.
My head's spinning right now on the possibilities for this because, in the space we work in, I can see this being such a benefit, not only for the client, the consumer, right, their family, but also that caregiver, where we can get them to control their days more and have a bigger sense of ability to flex around what they need to do in their life, right? We hear this work-life balance, and in healthcare, you hear the arguments it doesn't exist, but it sounds like you guys have created a huge benefit for caregivers as well too. Can you elaborate a little more on that, Stephen or Bryan?
Yeah, I mean, my favorite conversation is when I hear a provider call us up and say, I need to join your network because my caregivers want to be part of it, right? That's the way for us, because they earn 30 to 40% more with our model. And they have all those other ancillary benefits of controlling their own sort of destiny, so to speak, being able to control their schedules, being able to pick up and reject shifts if they're available or not. So that's the win for us, is like really moving the needle on caregiver compensation, which is the number one reason people are leaving the space. Right. When we talk about labor shortages, there's a whole bunch of factors that contribute to that, but wage and pay and compensation is number one. It always is. So, so to me, that's the win for us. And when you start hearing that, you said something before, I just think it's important to address, is like, we never go directly to companies' caregivers. We're not looking to kind of interfere with that relationship. That's your relationship as a provider. And I understand that coming from that world, how important that is. We're looking to augment it. We're looking to give you new tools to keep them with you, retain them longer, and also get them compensated better. Now,
this is a question I had as well too. Is this a service that can be used in, existing assisted living, memory care, skilled nursing? I mean, if someone needs some extra private duty care, like independent living, is this something that can be used in that element as well too, or is it more just in that home care setting?
No, that's a good point. Yeah.
I'll jump in, for instance. I was going to say, and that's how Stephen and I met. I did a stint at one of the larger senior living communities, and as we looked at it, independent living, it fits perfectly in, right? Because as we all know, I think independent living has moved up in the acuity level. It's not really true independent living. I think there's a lot of services that individuals are getting nowadays when they join independent living that the independent living community is not ready for, because they can't provide services. I can provide this home care company. We like this one, we like that one. But, one of the things we looked at and partners that we have today are independent living communities, even in assisted living a little bit, where they're using utilizing caring on demand as a kind of a selling mechanism to have people move into the community and have access to this more as a proactive kind of way to get care, right? Hey, move into the community. We have this program called Caring on Demand. It allows you to click care when you need it, if you don't need it, but you don't have to go through that headache of going out, finding a provider, calling different people, right? To your point of the family getting involved and having to do all that. I think that's kind of one of the big things in the independent living, that this kind of adds a nice little added benefit. It allows people to get care when they need it.
Well, I think it's incredible, because I'm just thinking the quality of life, the longevity now in independent living. I mean, you can have so many added benefits that you're not having to all of a sudden be like, oh, you're outside of our care scope. Here's some assisted living. You're like, I just moved 6 months ago. I have to move again. I mean, and then obviously, from the business side, that independent living, they don't want to have to turn those apartments over as fast, right? So now if you have a great service like this, someone that might need just a little bit of support could be there for 2, 3, 4 years versus, I'm sorry, you've got to have to move to, down the road to ABC assisted living because it's nothing we can do for you here or something. So that's power. I mean, that's power in the sense the consumer gets to make those choices. I mean, that is a fantastic platform.
Think about why do people move out of senior living? Either the acuity level is increased and they have to go into a skilled community or skilled facility, or they run out of money because they're spending to live in the community and they need home care. So they don't think about that when they move in. So now the average cost with Caring on Demand in one of the independent livings that we're working with right now, servicing about 40% of the independent living unit at this point in time, is under $450 a month.
I mean, so let's say you pay
exactly
with multiple touch points within that community too, right? So you're not okay. I'm getting somebody once a week for now. I'm getting somebody 2 to 3 times, maybe even 5 times a day coming
Jeez.
in and checking on it, right?
I mean, that's huge right there. Cause let's say your independent living's would only, you know, 2,000, which is probably low, but that's only $2,500 a month, right? Versus if you go to maybe somewhere else, you could be 5, 6, 7, right? Double, triple that, you know?
Mm-hmm.
I mean, that alone just, yeah, I mean, that's fantastic. I mean, that is power. So kind of, you know, where do you see this going next? What's your big focus, you know, kind of before we wrap this up, where do you guys want, I mean, what do you want to move this to next? This is going to be huge in a positive way.
Yeah, we definitely envision ourselves being part of the conversation in the broader healthcare system. We see ourselves being able to be vertically integrated in a lot of these different payer plans now, which are offering custodial care to Medicare Advantage plans. We see partnerships with ACOs probably coming down the pipeline, where we can kind of help reduce risk and kind of provide low cost, high touch care to some of their high risk clients. We just, there really is, it's endless possibilities within the space as we continue growing.
So so I just want to reiterate. So if someone wants to reach out and learn more, I'm gonna put it in the show notes, but drive them to your join the platform, right? Is that the best spot for someone that's curious about learning more, figuring out more of like, man, this could really be a need for us. Is that the best way for someone to go learn more?
That's perfect, Francis.
So, you know, so definitely if you're a home care provider, it sounds, I mean, even assisted living, any of your long-term care communities, check this out. This is going to be really powerful as a means to really meet your clients where they are without some of those other things stacked on them. Because like you guys said, independent living, this is great. I mean, $450, you know, average with multiple touch points a day. You can't find that anywhere else. I'll tell you that. I know that, especially in Colorado. So you guys, this is powerful. And I really appreciate, you know, you sharing this and the work that you guys are doing on this. So, you know, can't thank you all enough for jumping on today and really appreciate you guys being here.
Great. Thanks, appreciate it.
And we're going to move real quickly into our Maverick moments here. We're talking about our national collaboration aging event. It's happening here about, if I could do some math, a little over 2 weeks away here. And it's happening September 27th and 28th in Denver, Colorado. If you want to shoot me a direct message on LinkedIn that says I'm there, I've got a few discount codes left that I can share with you all to get some special pricing on tickets so you don't have to pay full price, save you a little bit of money. But really, we're filling up. We're almost at capacity for our attendees and vendors. So we'd love to see you there September 27th and 28th in Denver, Colorado. And until next time, go out, pay it forward, and be kind.